I'm very proud of it. This is what I do, and put some respect on it, okay? Welcome back to my channel. Welcome back to another video. I'm Cherie. If you are new, welcome. It's been a crazy week for me, so I apologize that this video is a little bit later in the week, but I made it. We're here. We're ready to give this video. I had a crazy week. I started school in less than like a month, and there's a lot going on. There's a lot that I have to do to get ready for school, and so I'm just very, very, very busy. So I wasn't able to. Oh, also another reason why this video wasn't out on a Tuesday is because I had dental work done and my mouth was still pretty sore, and I had a lot of pain still on Tuesday. I had it done Saturday, and Tuesday I was still in a lot of pain. So anyways, before I keep rambling on, as you guys see from the title, today's video is going to be talking about my career, being a medical assistant, some little tips, tricks if you're looking to get into the field. I have some advice, and yeah, I have a little book with everything written down. Otherwise I will keep rambling on like I'm doing right now. Let's get right into this video. I really wanted this video to be more sit down and more intimate, but I really did not feel like getting completely dressed up to do this video, so I decided to just do it at the desk. So yeah, anyways, so I've had the pleasure, the utmost pleasure of being a medical assistant for the past 4 years now. And for me, the transition to medicine was very, very, very wild, because I started college for art, and because of life events and some personal things, I made the switch over to healthcare, which was very, like, I never expected to work in healthcare. It was never something that was ever on my mind growing up. So it's very strange that I'm like working in healthcare, and I love healthcare now that I'm moving on to different careers and fields and whatever in healthcare. But so yeah, I've been a medical assistant for about 4 years. I basically work in a primary care doctor's office. We have a couple of different locations in Massachusetts, and I work for a primary care doctor. So basically what you do as a medical assistant will vary, but how to get into it, that's probably the most important thing, is how to get into it. So I did a 10-month program, and I believe that you can do anywhere from 6 months to 2 years, so you can get an associate's degree. And I would not suggest doing 6 months, because you learn a lot of information, and because there's so much information to learn, I don't think 6 months is enough for you to be able to get all that information in a comfortable way, to say the least. So I wouldn't recommend doing 6 months. I would definitely say going 10 months or longer. And if you want to, I would say definitely go ahead and get your associate's degree in medical assistant, because that would be very helpful in the long run for you. So yeah, basically medical assistants, if you're looking to whether get into healthcare, you're looking to get some experience, you already have your bachelor's degree, you're looking for experience, you want to be a nurse, you're going to med school, PA school. I work with a lot of people who are transitioning into those fields, and they want more experience, so they decide to become a medical assistant. So if you have a degree, you don't need to do a certificate program. You could just work as a medical assistant, at least at my job. As long as you have a degree, then that's acceptable. You don't have to go through a program. So program options, basically, at the end of your program, you can become a certified medical assistant or a registered medical assistant. Some programs, you don't have to take the test at the end of it to get registered. you can just, once you have the coursework and you have a certificate from graduated from that program, then that qualifies, and a lot of companies are okay with that. I know a lot of companies these days are requiring that people have the certificate. They do take the exam, so I would say definitely go ahead and do the exam. If it's obviously at the end of your program, it's going to be available to you for free, I think. But yeah, and then obviously you can go ahead and do your associate's degree as a medical assistant, which is going to take 2 years. And I think the pay, I don't know if the pay is any different, to be honest. I know if you have a bachelor's degree, the pay is different, but I'm not too sure based off your associates versus just doing a program. But I would look that up, and you guys, I'll put it in the comments down below. But so basically, when you go through the program, you do schooling. So I did the 10-month program, and you learn basically the basics of the job. You get to do like A&P. This was a long time ago, so I don't fully remember every subject that I learned, but the main thing was that you were able to do your clinicals, which you learn how to give injections, you learn how to take a blood pressure, do vital signs, because that's what the job entails. And basically you learn how to just be a people person and communicate professionally with people. And what else? You learn how to type. I think there was a typing class that I did, and like I said, give injections, draw blood. There's also the phlebotomy aspect of it. Whether you're gonna need, a lot of places medical assistants don't draw blood, simply because like a lot of places they have their own labs, they have their own phlebotomists that go ahead and draw blood. So I don't draw blood and I don't give injections, because we have the nurses do the injections and we have our own lab and phlebotomists that will do the injections. But basically, when you're done with school, usually each program they allow you to do an externship at your local hospital or nearby, and usually that's like maybe like 150 hours that you have to complete. I was lucky enough to get an internship at a very great hospital here in Boston, and I interned at the lung and chest transplant unit, and that was very cool. However, for me, I knew I didn't want to work there because the roles were very limited that you do. And I wanted to do more hands-on stuff. So that would be my next point, is deciding where you want to work. If you have the option, obviously, if someone offers you a job fresh out of school, you're probably going to want to take it if it pays well. But definitely think about how much admin work and how much clinical work you're going to want to do. So if you decide to work in the ED, your roles may be less, because in the ED there's like a person for everything. There's a ED tech, there's an EKG tech, there's phlebotomies, there's CNAs. So definitely think about where you want to work. Where I work in primary care, I can tell you guys what I do in my department. So basically, I'm assigned to one clinician, and I do just about everything for that clinician. So I room all their patients. They can see anywhere from like 20 to 25 patients a day. I room their patients, take vitals, and go over, medical history. And then I basically do that, and then I do like the doctor's mail, I take care of their faxes, and whenever there's incoming forms and stuff, we take care of those things. I write letters. I'm trying to think of the admin stuff. So writing letters, it's like you schedule appointments, you look over your doctor's schedule for the week, you do pre-visit labs, you put in lab orders, you can schedule appointments, schedule specialty appointments since it's primary care, and we're referring out. And then for the clinical side of things, I am more hands-on. I do EKGs, I do ear lavages, I do finger stick, glucose finger stick. We're able to do like an ACE wrap here and there. You teach patients how to use crutches and all that extra stuff. yeah, that's kind of like the day-to-day based off internal medicine. You set up for pap smear. I work with a male provider, so I help him with pap smears. So I usually set up their pap smears and assist with that. And then you can also assist with little small procedures, like if someone wants to come in for like a cyst or something and they want to do the drainage there in the office, then the clinician will ask you to assist them in doing that. But yeah, so that's pretty much like the basic job roles in terms of internal medicine and primary care. I don't really have much experience anywhere else. I've worked in internal medicine for 4 years, so yeah. And now since COVID, I've been working a little bit of urgent care, so but it's kind of still the same. I would say if you're looking, it doesn't necessarily get boring because it's internal medicine, so there's different cases every day. Patients are coming in for different things, so it's definitely not that boring. It can get repetitive in the sense where, like, okay, someone comes in for chest pain, you know you're going to do an EKG. Someone says their ears are black, then you're most likely going to do a ear lavage. But I think it's more broad than working in, let's say, OBGYN or like podiatry. At least with podiatry, you know, you're always going to be doing foot stuff. So definitely think about that. I'm glad I chose internal medicine because I got a broad, it's very broad, and I got a lot of experience with multiple different things, and there's a lot to learn in internal medicine. So if you're looking to further your career in medicine, I would definitely say start with internal medicine. Now, salary, that all depends on where you work, what state you live in. I know in Boston they probably start somewhere around $16, and you work your way up every year. Some places that you work, they offer you to grow. There's room to grow. So where I work, there is medical assistant 1. That's how you start. You can become a medical assistant 2 after a few years, and then there's a possibility for you to be a team leader and so forth. So there's definitely room to grow based off where you choose to work. All right, that was a mouthful. So yeah, like I said, you get a lot of clinical experience. So if you're thinking about going to nursing school or med school and you need that clinical experience before applying, I would definitely say that choosing to be a medical assistant is probably the best way to go. I have worked with a lot of people who have done this, and it definitely pays off in the end. You can come on, it's a very transitional role, and it's also a good role for someone who's a bit older and looking for something more stable. It's not the worst thing that you can do when you're older. So if you're looking for something more stable, you like healthcare, you don't want to go back to a 4-year college, I would definitely recommend medical assistant. So I want to talk a little bit about getting hired, and like, sorry, my notes are all over the place. I probably should have done a better job at this. But so like getting hired, externships. I was lucky enough to get hired like a month after school because my program partnered with a lot of employers that when you're done with school, they send your resume over and they'd be like, hey, I have a new MA, I think they'll be good for your position, give them a call type of thing. So I was lucky enough to get hired like a month after school. But in terms of externship, I would say definitely go at it, give it your all, like, because that's a potential job. You're probably going to be the first person they'll want to look at to hire, especially if they're looking for candidates at the time. So I would definitely say you want to show up on time for your externship. Make sure that you are not always on your phone, you're paying attention, asking questions, being proactive, take the initiative, because they will probably look at you. If they're looking for candidates, they'll probably look at you first because you're there with them. You already know the building, you already know some of the things that they would have to train someone else to do. So I would definitely say take your externship very seriously. Where I externed, they weren't looking for an MA, but they ended up getting an interview in their internal medicine department. Kind of glad I didn't get that job because I don't think I would have liked working at a big hospital. All right, so definitely something that I want to say is that if you're not passionate about people and helping people, then it's definitely not the role. Like, healthcare isn't the place for people like that. So, you know, it's medical assistants make good money. It's a good way to get into the field. But if you're just like, if you don't have empathy, you don't care about people, there's one thing I always tell people: you don't have to like people, but you have to care. Like, I don't like a lot of the people that I see, but I care, and so that makes the difference. So make sure you are passionate, you have empathy, you care before you step into the role of healthcare, because these are people's lives that we're dealing with daily. As a lot of people might say, oh, I'm just a medical assistant, but honestly, medical assistants are such an important part, especially in smaller practices, even big ones. You know, without you, like, your clinicians don't really function. So make sure you are giving it your all, and you do the best you can, whatever you do, wherever you are on the food chain. You always do the best you can. You always put out, make sure you care about people, and you always smile. That's something I needed to work on when I first started, because I was not a smiley person or like that friendly. I had a little bit of social anxiety, and being a medical assistant for the past 4 years has definitely like opened me up a bit. But I love healthcare, and I'm like very excited that I decided to make the switch from art school to medical assistant. I've learned a lot over the years that I'm grateful for. You just learn a lot. There's a lot of information, and if you really love medicine, then you will definitely enjoy your work. I do enjoy my work. I love patients. I love doing stuff for patients. I love the clinical side of it. I don't love the admin side of it that much, which is why I'm not staying in this role. But I think if you work in like an urgent care department, I don't know if you do a lot of admin stuff, but I'm not sure. And like, a lot of people still don't know like who medical assistants are, what they do. People still think I'm like the nurse. They think I'm a CNA. And I'm just like, no, this is my role. Like, this is my role. I'm very proud of it. This is what I do, and put some respect on it, okay? Never just say, oh, I'm just this, I'm just that. You are important. Medical assistants are very important. A lot of places would not be able to function without medical assistants. So if you're looking to get into healthcare, I would say definitely choose a medical assistant. Even if you want to be a nurse, I would say be a medical assistant and not a CNA, because you get to do more stuff. And if you want to be a nurse in like the ED or something, medical assistants definitely going to give you that experience to do that. Because like, also like medical assistants, especially in internal medicine, like primary care, we respond to code calls, you know, rapid response, like emergencies, we are responding to that. So it definitely will give you that experience and get you ready for like nursing or being a doctor. Because then, especially if you're going to med school, it gives you both sides. You'll be a better doctor to your medical assistant in the future, because you worked side by side with a doctor. You've done the job as a medical assistant, so you'll also be able to treat your medical assistants better, because not all doctors are nice, so keep that in mind. But yeah, that's basically all I have for this video. I really hope that this video was very helpful. If you have any additional questions, or if I left anything out, then just comment down below and let a girl know. But yeah, if you have any questions, I'd be happy to answer them. And yeah, I will see you guys in my next video. Bye.